the system for patient care was in the hands of the regions. Again, all the aspects of care were covered: the hospitalization, the outpatient, the pharmaceutical, the residential care, the home care, the emergency, and the regions started to work in this field. So they created either their own digital agency, and that started the difference that are typical in our countries. You can see the northern part of the central northern part of the country already quickly responding to the challenges, while the southern regions lagging behind. So just last year, most of the regions have implemented their programs. We have still 3 regions and 1 autonomous provinces relatively lagging behind. Concerning the topic we are discussing this morning, the telemedicine, we have an incredibly heterogeneous country. We have remote villages in the mountain, in the Alps, in the north. We have rural areas such as these in Tuscany, and we have villages which are very difficult to reach, such as these in the south. So essentially, we had to develop something which can fit for them, and of course, you can understand that there isn't a solution that fits them all. This is why I started the National Center for E-Health and Telemedicine at the National Institute of Health, providing essentially a method supporting the regions and providing them with the support in understanding their epidemiology, their needs, their demand, and then supporting them in the feasibility study for making a specific project for the specific areas of the regions, making and helping them in starting up the project with sustainability, and of course in helping them in the service stabilization. And we had incredible success in some regions, and you can imagine some problems in others. And the lessons learned are that, of course, interoperability of digital solutions has a technological challenge, but this is not the main challenge. Most of the stakeholders do not understand that we are leading a revolution. It's a different kind of revolution without gunpowder, but it's still a revolution. And even though the health systems already evolved, there is still a need for another wind of change. There are still too many people that believe that the systems have to be like in the 20th century. So doctor-centered, the patient seen as passive complier, the major pillar being the hospitals, the bureaucracy to drive the show, driven by finance, more money as a solution to the problem, highly polluting, focus on effectiveness, which is a great thing, but of course we believe that now we have to focus on value and on reducing waste, and challenges particularly by some stakeholders met by growth, and we believe they should be met by transformation. And I underline the importance of the new revolution that we are leading, which is based on knowledge, on citizens, and on digitalization. In particular, if I have to say what is the most important technology that we have to deal with, is the smartphone. And so we have to work in particular with the smartphone that every citizen in our world has. So we can have a bright future if we integrate the technological, the organizational, the normative, the structural, the economic, the professional, and the cultural challenge. And in our opinion, we have to align to make a very effective change all these elements: the vision, the skills, the incentives, the resources, and the action plan. If we miss the vision, we generate confusion. If we miss the skills, we generate anxiety. If we meet the incentives, we generate resistance. If we don't have enough resources, we generate frustration. And if we don't have an action plan, we have a false start. I believe that accommodating and including all these elements in the strategy can be a good lessons learned for everybody. Thank you very much for your attention.